morning, everyone. Thank you so much for joining this webinar today on a Saturday. I'm going to request Santosh to get on the call and address the team. Thank you.
Thank you very much, Swapna. So a very warm welcome to all the clinicians, researchers, innovators, developers, partners, friends, and guests joining us today. It is a pleasure to welcome you all to the launch of webinar for the Digital Health and AI Hackathon 2026. Before we dive into details of hackathon, I wanted to take 2 minutes to provide high-level updates on NCG KCDO's key initiatives. So LEAP and EMR adoption has been one of the key initiative. 18 hospitals are already at a various stages of implementation. Some of them have already gone live. For another program called RIS and PAC standardization, NCG team is working very closely with NABH team to finalize RIS and PAC standards for different sizes of hospitals. We recently, in fact, completed industry consultation for the developed specs, and soon we will start the vendor empanelment as well. Another program, which is a Cancer AI Technology Challenge Grant, which we launched in last year, August 2025. We completed application assessment and 10 winning solutions were announced at India AI Summit in February. We also published the compendium covering the solution overview. As of today, 7 out of 10 winning solutions have already received the amount of first tranche. Others are in a process of getting the funds, and the implementation of these solutions will start soon at the selected hospitals. Now coming back to webinar, healthcare today is witnessing one of the most exciting period of transformation. AI is evolving rapidly. Digital technologies are becoming more accessible than ever. And together they present unprecedented opportunity to improve healthcare delivery. So I request Dr. Ramesh to provide overview of Health-a-thon and start this.
Thank you. Thank you very much, Santosh and Swapna, for organizing this. And again, a very warm welcome to everyone who's joined in on the call. I think we are preaching to the converted when we say AI is going to transform our lives. Just as we were starting this very webinar, I noticed that close to 30 AI note takers were operational as even for this webinar. So it just goes to say how much we have begun to rely on AI even in our daily lives. And so I don't want to waste time impressing on this audience about the importance of AI. Predominantly, as we've gone over the past few years, we've had remarkable advances in AI, and especially with its application in healthcare. And these have broadly fallen into two broad buckets. The first, and something that many of us are working on, is the clinical applications of AI. Things like image analysis and radiology and pathology. How can we make more accurate diagnosis? How can we assist clinicians, radiologists and pathologists make more accurate diagnosis? And this is certainly a very important part of where AI should be used. And as Santosh mentioned, our initial effort at the grant challenges in the use of AI in healthcare through the Catch grant, which we partnered with the India AI mission as part of MIT's AI efforts, has resulted in 10 larger grants to teams consisting of clinicians and tech companies. But also, in addition to that, we are also funding 18 smaller grants to others who came lower down the ranking list, but certainly we felt were important enough initiatives to support. And what was heartening to us was the fact that we had to make very tough decisions amongst close to 300 applications that came in, clearly demonstrating that the ecosystem for AI in healthcare in India, and this was restricted only to cancer, has certainly become quite mature. So while the clinical applications are extremely important, the other vertical that we are looking at in the use of AI is the operational aspects of healthcare delivery, or the non-clinical applications of healthcare of AI. And if you were to ask a clinician on the ground, these are as important, if not more important, than the clinical applications. So if we were able to crack very mundane routine problems like how can scheduling in an outpatient clinic be made more efficient? How can EMR entries be made more efficient? A clinician will probably tell you that these are as important, if not more important, than the clinical applications. And while the clinical applications are more glamorous, they attract more eyeballs. I don't think we can underestimate the on-the-ground impact that operational aspects of AI in healthcare would do. So I don't want to spend too much time because the purpose of this webinar is to actually share how we approach and the Koita Foundation and the various Koita centers for digital health, including oncology, diabetes, and maternal and child health, are approaching this problem, because all three associations feel very strongly that we need to enable and create an ecosystem where these non-clinical applications are supported and actually deployed on the ground in hospitals. So back to you, Santosh and Swapna.
Thank you so much for that, Dr. Pramesh. So I would like to call upon Vikas Tiwari, who is now leading the Health-a-thon 2026 initiative. He'll be taking us through the vision, structure, and also the journey of the hackathon this year. He will also be walking us through how US oncologists can participate, identify relevant use cases, and also complete the entire application process. So over to you, Vikas.
Thank you, Sapna. Thank you, Dr. Pramesh, and the entire National Cancer Grid team for giving me this opportunity to introduce the Health-a-thon challenge to the entire NCG community. So before we get started and deep dive into the Health-a-thon challenge, I just wanted to launch a pre-survey question for all the participants who are there in the webinar. Just select your responses. We will also be taking a post survey. These are merely 3 questions, which I would request you to just click and fill it. So while people are filling this survey, let me start with a quick pre-note. So what I'll be doing, I'll be just spending the next 20 minutes introducing you to this new challenge that we have launched jointly in collaboration with NCG, Quetta Center for Digital Oncology, in collaboration with IIT Bombay, Foxy, RSSDI, and Quetta Foundation. I would actually like to begin why we felt was there a need for an initiative like this. So over the past few years, as Dr. Pramesh has rightly mentioned, we have all witnessed extraordinary progress in digital health and artificial intelligence, right? There are new technologies like which are emerging at an unprecedented pace, and there is tremendous excitement about what they might enable in healthcare. But at the same time, one questions keep coming back to the healthcare community, that how do we ensure that these technologies are solving the problems that actually matter to doctors and healthcare teams? Because the people who understand these challenges best are the people who are working on the ground. They are the doctors, they are the nurses, they are the healthcare professionals, they are the healthcare coordinators, and they are the healthcare teams who deal with these challenges every single day. That simple thought became the starting point of this Health-a-thon challenge. So Health-a-thon has been created on a very simple belief that the best healthcare solutions are built when doctor and healthcare professionals who understand the problems work alongside technology team who build the solution. This challenge is therefore not about asking technologies teams to guess what healthcare needs. It is about creating a platform where clinicians identify the problems, define what needs to be built, guide the solution throughout the development, and ensure that every solution is grounded in the realities of their daily practice in healthcare. We believe this collaborative model has the potential to create solution that not only is technically innovative but also practically relevant and implementable within our healthcare system. So that is the vision behind the Health-a-thon 2026. So now before I explain how the challenge works, I would like to spend a few minutes talking about why we felt there was a need of initiative like this. As of us on this call understand that delivering good cancer care extends far beyond making the right clinical decisions and the treatment, right? Much of the efforts in cancer care depends a lot between what happens between consultation and the treatment. Patient needs to be followed up over months and often years. Investigation needs to be tracked. Chemotherapy cycles needs to be coordinated. Referrals needs to be completed. Tumor board recommendation needs to be acted upon. Patients and caregiver need guidance throughout their treatment journey. Doctors and care teams spend significant time reviewing records before consultation, coordinating across departments, responding to routine patient queries, tracking pending investigation, and ensuring that the patient do not get lost during the care journey. These activities are fundamental to delivering high quality care, yet they all consume a significant amount of time, coordination, and administrative effort. And as patient volume continue to grow, managing these activities through multiple systems, spreadsheets, phone calls, WhatsApp groups, and manual processes becomes increasingly difficult. This is exactly the kind of challenges that we are focusing on Health-a-thon, not because they are simple, but because even solving even one of these problems can significantly and meaningfully make a difference, not by improving the experience of doctor and the care team, but also by improving the experience of a patient and the caregiver. That naturally brings us to the next question. So why this is the right time to launch this initiative? See, until recently, most of the healthcare software was designed primarily to digitize information. So we have EMR, which helps us to store patients' records. We have HMIS, which digitizes transactions and workflows. Different applications supported different parts of the healthcare journey. But very little of the technology actually reduced the day-to-day coordination and the administrative effort required by doctors and the healthcare team. But today that is beginning to change. The recent advances in the AI are enabling softwares to move beyond simply storing information towards actively assisting users in completing everyday tasks. Across industry, we have already seen intelligent assistants that can summarize documents, organize information, draft emails, identify pending actions, answer routine queries, and help users complete repetitive works more efficiently. A similar opportunity is now in healthcare, right? Imagine a care team beginning the day with an automatically generated list of patients who have missed chemotherapy, follow up appointment, or important investigation. Imagine every consultation beginning with a complete, concise patient summary that brings together the patient's treatment history, recent investigation, pending action, and the key clinical events from multiple systems. Imagine automatically tracking whether referrals, investigations, or treatment milestone has been completed and highlighting patients who require follow-up. Imagine patients and caregiver receiving timely reminders, preparation guidance, and answer to routine questions while only important issues are escalated to healthcare team. Intelligence assistant supporting doctors in preparing teaching material, summarizing literature, organizing tumor board discussion, and reducing their routine administrative work. These are no longer futuristic concepts, right? Many of these concepts and capabilities are already becoming possible. The opportunity before us is to ensure that these technologies are developed around the real need of healthcare. That is precisely where doctors become central to this innovation process. One important point I would like to clarify is the Health-a-thon is not looking for clinical AI solutions related to diagnosis, treatment recommendation, medical report interpretation, or CDSS. Instead, we are looking for those practical solutions that can strengthen the way healthcare is delivered by simplifying, coordinating, improving patient engagement, supporting the healthcare teams, and reducing their manual and administrative operational efforts. So this brings us perhaps to the most important questions. So what kind of ideas are we looking for? We have identified a certain number of use cases where technology has potential to make a meaningful difference. But these examples shown on these slides are some of the illustrative use cases only. Like, for example, a team may choose to work on a patient follow-up and a continuity of care solution, helping the care team identify patients who have missed chemotherapy, investigation, or follow-up before they lost due to their treatment journey. Another team can focus on working on a solution which is on consultation readiness, helping doctors begin their consultation with a complete understanding of the patient's journey by bringing together all the relevant information. Another team can choose to build a care journey companion for a patient and a caregiver supporter that supports patient between the hospital visit by providing timely guidance, reminders, and state specific information throughout their journey. But these are all examples, and are intended to stimulate your thinking. They are not intended to limit the innovation. In fact, one of the unique aspects of this health-a-thon is that doctors are encouraged to bring their own problems, their own ideas, their own challenges which they face or encounter in their own day-to-day practice. If there is any repetitive activity that consumes their valuable time, if there is a coordination challenge that affects your patients and your care, if there is an administrative process that you believe could be simplified, if there is a workflow that repeatedly makes you think there has to be a better way of doing this, then that is exactly the kind of problem statement we would encourage you to bring to Health-a-thon. Over the past few weeks, we have already started receiving a very good number of registrations from doctors across the country, and many of those ideas are being submitted are completely different from the illustrative use cases that we have originally identified. And this is what we are exactly hoping for. Because ultimately, our objective is not to build solution for a predefined list of problems, but our objective is to create a platform where doctors and technology innovators can come together to solve the problems that matter most to them and the healthcare. So far we have spoken about why we have created this health-a-thon, the opportunity that exists today, and some of the challenges that we believe worth exploring. So the next question is, what can a team actually build? So the answer is intentionally broad. So every team will choose one of these three focus area, either cancer, diabetes, or maternal health. Within that domain, they can either build a doctor or a care team facing solution, or a patient or a caregiver facing solution, right? But I wanted to emphasize one thing very clearly. So these examples are not the boundaries of the challenges, right? All the use cases which I spoke just in the previous slides are only examples to help you think what kind of problems that you could address, right? You may have identified a specific problems and built a focused solution around it. You may combine several use cases and come up with one workflow solution, or you can make identify an entirely different healthcare challenge from your own practice. So don't look at this slide and ask what are these operational challenges I should be choosing. Instead, you should be thinking from your daily practice, like what are the problems that take up your time, right? And which are the solutions that you really need to work on. So what we need to ensure in all of these design principle is that whatever solutions that you're making, you need to ensure that it is practical, it is high impact, and it is covering your everyday healthcare challenges. It addresses a meaningful workflow pain point in a healthcare ecosystem and your everyday healthcare workflow. It should be fitting naturally with the existing hospital and the clinical workflow, rather than the hospital or the care team needs to change the way that they operate, right? It should be able to work with any information or any system which is already available. We are encouraging the teams to apply all the available AI capabilities, including your AI agent, orchestration workflows, APIs, and any open source tools which are there in the open source domain. So now who can participate? So the challenge is open to broad range of participants across all the healthcare and technology ecosystem. So we welcome doctors, healthcare professionals, as well as health tech companies, startups, technology innovator, researchers, and students. So you can participate in two ways. We welcome doctors and healthcare professionals as well as teams to come as complete team, bringing your clinical and your technology expertise, or you can register individually. We will facilitate the team formation during the challenge. In terms of the team structure, so the question is, what happens if I have a problem but I don't have a technology partner, right? We have designed the participation model specifically to address this. So every team will have 2 to 5 members with at least one practicing doctors as a clinical lead and one technology member. If you already have a technology partner or a technology team that you would like to work with, you can register together. You can build your team around the people that you already know and work with. If you don't have a technology partner, please don't let that stop you from registering. You can register individually. During the registration, you can tell us your domain and the area of interest and the problems that you would like to explore. We will help you match make with a suitable technology partners through the platform. The same applies to a technology team. If a technology team has a strong interest in healthcare but does not have a clinical partner, they can register individually and we will facilitate the matchmaking. We have already started receiving registrations from both the sides. So matchmaking process is already beginning in the back end. So the idea is simple. The doctors bring the problem and the clinical expertise. The technology partners bring the technical expertise, and the team works together to build the solution. Every solution needs to remain clinically guided throughout the journey, from defining the problem to developing or refining the prototype. That brings to the another important questions that we often hear from doctors. So what exactly am I expected to do as a doctor? The answer is quite simple. You're not expected to code, you're not expected to build any software on your own, you're not expected to become an AI expert. Your most important contribution is your clinical expertise and your understanding of the problem. You will help the team understand what happens today, explain the current workflow, define what needs to be solved, participate in the discussions around the solution, and as the prototype develops, you will help validate it and provide feedback. Is this actually solving the problem? Would this work in a hospital? Would a doctor or care team actually use it? Does it fit into the way care is delivered? Those are the questions that you as doctors are the best place to answer with. Your technology team will lead the design and the development. You will help ensure that they are building the right thing, and the guidance continues throughout the hackathon. So if you ever thought, I wish someone would build a solution for this problem, this is your opportunity to actually work with a technology team to help shape that solution for yourself. Now, let me briefly take you through what the journey of this hackathon looks like. So, it starts with registrations, which is right now ongoing and live. So, doctors and technology participants can register either with their own team or individually. For those who register individually, we will facilitate matchmaking and team formation based on their selected domain and selected use case. Once the teams are formed, the next stage is a round one submission, where the teams along with their clinical partner will define the problems what they want to address and the solution that they are proposing. The shortlisted team will enter a 5 weeks build sprint window along with the mentoring phase. So this is where the real collaboration happens. The doctor and the technology team will work together to develop and refine the solution with access to mentoring and supporting along the way. Throughout the build sprint, we what we will be doing, every team will be supported by a dedicated mentor from the technology as well as from the clinical side, who will help them refine the problem statement, strengthen the solution approach, and provide continuous feedback as their prototype evolves. Along the way, we have also organized a series of masterclass led by faculty as IIT Bombay and other industry experts. These sessions will cover some important topics like AI technologies, product designing, user experience, implementation, and pitching and building the solutions. We also want this to be highly collaborative experience. So, which is why we will be organizing some informal networking and mixer sessions at IIT Bombay, bringing together doctors, startups, technology, mentors, and industry experts. These sessions are intended to encourage like brainstorming, collaboration, peer learning, and the exchange of ideas beyond the formal competition. So at the end of the build sprints, the team will submit their final submission. The top 10, 30 teams, 10 from each track, will be invited to the national grand finale at IIT Bombay on 28th of November, where they will be demonstrating their working prototype to a national jury. And there is a total prize pool of more than 54 lakh, along with certain technology credit partners that we are getting in. We will be also recognizing the top solution nationally and showcasing them to across our partner network. We also intend to create a repository of all these solutions developed throughout the Health-a-thon challenge, so that promising ideas receive continuous visibility and have an opportunity for further development, collaboration, and real world pilot and adoption. But beyond the prize, we see the build sprint and the grand finale as an opportunity to take the ideas that emerge from your day to day practice, give them a platform to be developed and demonstrated, and potentially be taken forward. So, before we conclude, I would like to invite our hackathon partner to quickly walk you through the Health-a-thon platform that we have built to support your entire journey. So everything from registration and team formation to matchmaking, idea submission, mentoring updates, and the announcement will be managed through this entire single platform, making it easy for you to participate, track your progress throughout the hackathon progress. So over to you, Samir.
Thanks a lot, Vikas. So first of all, good morning to all of you. I'll be taking you through the platform and a step-by-step process of how you can register yourselves. So this is the platform. I think Vikas will also share the QR code and the link with all of you for you to register. So going forward, as Vikas just mentioned, it's for hackathon is focused on non-clinical, operational, and workflow problems, with these being our main partners. The use cases and problem statements, these are the templates that you have pre-written and which you can customize on top of. Um, yeah. So, like I was just mentioning, as Vikas already walked you through the whole platform and the program in itself, the Health-a-thon for doctors and technologists co-creating AI solutions. We start with a joint initiative with all of our major partners, Foxy, NCG, RSSDI, IIT Bombay, KCDH, and the Koita Foundation in itself. And rightly mentioned, it focuses on non-clinical, operational, and workflow problems, not diagnosis, not clinical decision making. Use cases and problem statements that you can use as templates to build on top of is already available here. And all of these are not something rigid that you must follow. It is only something as a suggestive use case, which you can build on top of or bring your own use case as well. Design principles and hackathon scope as to how each of the technology aspect of it, the human-centered and safe approach, assistive impact and delivery, and what is in scope and out of scope is completely mentioned here. Going forward, who can apply, like Vikas rightly mentioned already, doctors, medical students, healthcare professionals, startup and health tech, technology teams, and engineers. Team structure is 2 to 5 members with a doctor and a technologist as a must. The overall reward is 54 lakhs. And beyond the prizes, you have access, recognition, certificates, and networking. Now I'll take you through the whole platform as to how you can register yourself. So when you hit register, at first you will have to create your own account. I'll just start by creating a fresh account. You will have to enter your phone number and choose a password of your liking. Once you've done this, the account is created and you have to choose a path how you are taking part in the particular program. So if you're a clinician, you would go towards I am a clinician. And if you're a technologist or a tech enthusiast who is participating as a developer, you would go towards I am a technologist part. So in under I am a clinician, I'll show you both the parts one by one. So in under the clinician, there's 3 steps, 3 different paths that you can take. One is if you're a practicing doctor. The second is if you're a medical student or a trainee. And the third, if you're a healthcare professional other than these two. So let's go with practicing doctor first. You would be asked to put down your NMC registration number, which I would be putting down now for demo. You would be asked to put down the institution that you're associated with, the professional association with NCG, Foxy, RSSBI, or other, and register as a team builder. If you're choosing NCG, Foxy, or RSSBI, the details of your affiliation would also be needed to be added in the form. Now, once you've done this, you continue to your team. Then you choose between the 3 options as to if you're bringing your own team, joining an existing team on the platform, or you're looking for a team. If you're creating the team and adding people to your team, you would go with the first option. That is, I'm bringing my own team. If one of your colleagues or one of the people that you know has already made a team which you want to join, you would be going to, I'm joining an existing team on the platform. And if you're unsure, if you're unsure and nobody that you know is actually on the platform and has created a team, at the same time you have nobody to bring as your teammates, you can always choose a third option. That is, I'm looking for a team and we will matchmake you in the backend, like Vikas mentioned in his brief. So for the first part, I will go with I'm bringing my own team. I will name my team as I'll name my team as Wattpad. Then I would choose the domain that I want to work on. It can be cancer care, diabetes care, or maternal and health. For example, let's choose cancer care. Under cancer care, or under any of these tracks, actually, you can choose either to work on a doctor facing problem or a patient facing problem. Let's, for example, choose a doctor-facing problem. You would be shown all the use cases that you also saw on the landing page, on the first page, that the home page that you saw. These are all those use cases which you can select, read, and customize at the bottom, or you can bring your own problem statement, describe your problem statement from scratch, and submit a registration. For the purpose of this demo, I'll be choosing this particular use case, and I will be submitting my registration. This would work the same if even if it's a patient facing solution, based the difference being the use cases under that, and even if it's a different track, that is a diabetes care or maternal health care. Once I've submitted my registration, I've arrived at my dashboard. So you would also come at this step where all of the details that you've chosen till now is shown on the dashboard. Your team details are shown here with a manage team button, and what happens next as the timeline is shown below. So let's continue with manage team. Under manage team, under members, right now I'm the only one which is being shown. Now the team code on top can be copied and shared with your colleagues or anybody from a technology team that you want to partner with. So if you're copying the code, or if you know somebody that you want to add directly as your team member, you can enter their name, role, email, mobile number, and add them to your team. The requirement of a team composition would be 2 to 5 members with one clinician and one technical lead as a must. As in, when you add people to your team, you can assign roles to each of them. So as to who your doctor partner, the main clinician lead would be, and who your technical lead would be. So this is create a team flow for a clinician. Now I'll show you join a team flow. Let's register another account here. The procedure for creating an account remains same throughout for any role or any theme that you're choosing. You would again create a password of your choice. And once done, we'd come back to this part. To join a team, let's continue with I'm a clinician for now, and I will go with a medical student domain. So as you can see, if you're a practicing doctor, like we already saw, you would choose your NMC registration number, institution, and professional association. Likewise, if you're a medical student, you would have to fill the medical college or hospital details, institution email, student or resident ID, and your year of study. So let's say I continue with another registration. Now I choose I want to join an existing team on the platform. Suppose the team flow that you already saw in the first account, where I was bringing my own team, if that person wants to invite another person to his team and he has shared the team code with him personally or via an email and not added him directly, he can come here, paste his team code, and continue. As simple as that. Then he would go to the same flow where he would choose a domain track, a solution that he wants to focus on, choose a use case, customize if needed, or bring from scratch, and submit a registration. Like you see, under the team, now you have 2 members. That is under manage team, the first account where the team lead was already there, and the second account where a person joined the team are both available. Now, if you go back to the first account, another person would have appeared here. Now you can assign them roles as to who your doctor partner is and who your technology lead is. So if I assign it, then he would be a technical lead. Only the team lead can assign anybody as a doctor partner or as a technical lead, and no other person would be able to assign that. Now we will go to a third flow. I would have to enter another phone number. I would be choosing a password. Let's say now I'm a technologist that wants to join a team. First step would be if you're a working professional, a student, or a researcher in the particular domain. Let's say I choose the path of a working professional. Once I've chosen that, I would have to choose the organization type. So for a clinician, this part would not be relevant. This is for a person who is a tech enthusiast or a technologist who wants to join a team or bring his own team. So first, I would have to choose a type of organization that I work with. If it's a health tech company, a startup, a technology company, academic institution, government public sector, or independent consultant or freelancer. Let's say I choose startup. I would have to fill the details of the startup. I would have to choose my role. I would have to choose the registration status, and I would have to choose my particular area of focus. Once I've done this, I would come back to the same place where I have to choose if I'm bringing my own team, joining an existing team, or I'm looking for it. We've already seen these two flows on the clinician end, where I'm bringing my own team, where I create a team, and I have a code to share or add people to my team, where I join a team, where somebody I know or somebody who has invited me has already created a team on the platform, and I'm joining him as a team member. Let's now try the third flow. That is, I'm looking for a team. I'm not sure as to if I who I want to bring with me, or I don't know anybody who has made a team. So if I'm looking for a team, I would have to choose what I bring as a technologist. If I bring software development, if I bring UI UX, data science, or biomedical engineering, let's say I bring all four for now. I can put my portfolio or GitHub, which anybody can see. Our AI on the backend would use this data to be able to best match you with with the people that match your interest the best. Next, we would go to the domain and track that you want to go ahead with. Clinician focus or patient focus, just like you saw on the clinician end. Choose a particular use case or bring your own use case and complete the registration. Now, because I've chosen, I want to be a matchmate where I do not have, I'm not bringing a team or joining a team. I directly go to the dashboard where I can set up my own team later on, or you can just wait at this stage for us to match make you with your best possible interest. Now, while you wait, let's say somebody else invites you to your team and you want to join that particular team. You can always go to set up my team or join with the code, or in case you change your decision, you can always create a team now. And that's it. I would again be a part of that team. So this
Thank you,
particular,
Samir.
yeah,
Thank you, Samir. I think it is clear in terms of the registration. So what we will do for all the members for that is we will create like a 2-minute short video and we will share it with all the folks so that
perfect.
they have a clarity in terms of it. What we want to clear is that the registration flow that we have there is very simple. So people can register with team, people can register individually, people can register with their tech partners, without their tech partners, anything. There is a simplified flow. So I would request all the individuals to just scan this QR code and participate. So what we have also created, we have created a dedicated WhatsApp communities for doctors and the technologies team where you can connect with the other participants, receive any important updates, ask questions, and stay engaged throughout the challenge. If you have any questions at any stage, you please reach out to us. You can contact me directly on my email ID. I have given my email ID and my phone numbers, or we will be happy to help you and guide you with your registration, team formation, or any other queries that you may have. So before I conclude, I would just like to leave one simple thought with all of you that every one of us who has been working in the healthcare has experienced moments, right, in our daily practice where we have thought there has to be a better way of doing this. That frustration, that everyday movement, that everyday challenge could become the next health-a-thon solution. So it doesn't have to be a big idea or a small idea. Sometimes solving even a small high frequency problem can make a meaningful difference to thousands of patients, doctors, and care teams. So if you have an idea, a challenge or simply a problem that deserves better solution, I would strongly encourage you to register. So with that thought, I am going to conclude my presentation. I am just going to open our post survey form, and till that time I am happy to take questions from the participants.
Thank you so much, Vikas. That was a very detailed presentation. Group, we would really like to understand. So, as per the pre-survey findings, it's very clear that there are a lot of operational challenges that are faced by you, right, in your everyday work. So, it'll be great to know if you all understood how you have to register. That is one, but also I would urge you to think and probably ask about what are the different use cases you feel you can register with. So if you have any confusions around that, it'll be great if you can just ask your questions here.
I had a question. So, in the registration, we've been asked to look at different verticals, like in the patient facing also, we solve one problem at a time. Is it possible to do for a single solution to, like if we have a single solution to across verticals, then what do we do? Then we give our own, is it? Like,
Thank you, Dr. Rohan, for the question. So in terms of, if I'm understanding your question correct, you're saying ki, let's say you selected a cancer as your domain where you're building any
yeah,
solution, and
yeah,
you're selected patient facing solution as your platform, and there are
yeah,
multiple use cases. So your
yes,
solution can work on multiple
work
use
across.
cases.
Yes.
It is open. So it is open. So you can use any one use case for solving. You can combine 2-3 use case, or you can actually come up with a connected solution which can do a lot of other things. So it is open. So it is open to innovation. So there is no restrictions to that.
Actually,
And
with the operational solutions that we are looking at, that is precisely where we think this will go. Though you might start with your solution working in cancer, with many of these, they may not be cancer specific, they'll be disease agnostic and can be used in other applications. So you could just pick the one that is closest to you, the one where you're likely to have the right partner to work with, and demonstrate that. Nothing to prevent this from being a really good solution for the other verticals as well.
Okay, thank you, sir.
Sir,
Can
I
we
have a question. May I?
Please.
Yeah, I'm Dr. Rupa, sir, from Ramaya. So I'm a diagnostic pathologist. Now, here the verticals mentioned are either the clinicians or the technical partner, and then the medical students. So where do I fall in? Because I'm a diagnostic pathologist.
So we consider all pathologists, radiologists, nuclear physicians, all of them as clinicians.
Oh, okay. Okay, fine. Thank you so much.
can I ask a question?
Yes,
please go ahead.
yes, please.
Ramesh, I want to know, we have a nursing college attached to our hospital, and we have MSc nursing students who have to do a research over a 2-year period of their training. In addition to that, we have good amount of data. Can we get help through this to analyze our data, ask questions, and get answers? Difficult.
For the limited purpose of this call, Health-a-thon, we are actually looking at tech AI solutions which address common problems. So if any of those projects involve fall into this definition, they could be matched up with technology partners who will be able to help. The purpose of this call is not to analyze data that's already collected and see where it goes.
No, I get your point, but the thing is that we have noticed a very high incidence of positive family history in our cohort of patients, which goes beyond around 25 to 30%, which is unique. So we want to address that at the level of population and see how we can do that.
So the NCG will come out with the NCG actually has a round the year call for research proposals where this might fit into. But again, this probably may not fit into this particular call, because here we are actually looking at how can we use AI to solve common problems faced by patients or healthcare providers.
So, Dr. Shad, Santosh here. I'll get in touch with you in terms of sharing the details how we can, go through this research proposal application way, and then I'll see if any of the partner is interested in working on this problem.
Thank you very, very much. Thanks a lot.
Yes.
Thank
Dr. Shad, I'm just sharing a link to on the NCG website where you can actually submit the proposals. And as Santosh mentioned, we can obviously connect and discuss this further.
Obliged.
Hello.
Yes, please. Any other questions?
So one of the things that I wanted to point out is the fact that we've got some very aggressive timelines here. So I would request you to just go through the link and the QR code that's been shared and start working on your proposals at the earliest, because the whole thing is supposed to culminate by the end of November. So we've got some really aggressive timelines here.
Sir, I have one more question, sir. Would you mind?
Not at all. Please go ahead.
Sir, how many collaborations can we bring in to connect our own network? If we are already working with them and we are comfortable working with them, so how many collaborations can we bring in? Is there any upper limit? Is there any ceiling?
Vikas, you want to take
Yeah.
that?
No, ma'am, there is no ceiling. Only whichever team is applying, right? The doctor partner has to be different. If the tech partner is coming with multiple doctors, that's open. So there is no ceiling in terms of the tech partners applying across multiple use cases or multiple domain. But there needs to be a clinician lead who's different and who's external. So, for example, I'll give you what should not happen. So there is a tech company who on his payroll already works with a lot of doctors. Those doctors cannot become the clinical lead in this challenge. They can be a team members, but an external doctors who they work very closely with can become the clinical lead. But that is not stopping them to apply with other doctor folks or other doctor partners that they have been working across the other use cases. So they are open to apply as many number of time. Only the thing is the doctor partner has to be different.
No, how can you say? Now, for example, sir, can I give you an example here? See, me being a diagnostic pathologist, the pathologists usually have more than 2 or 3 pathologists because to arrive at consensus. Sometimes we have difference of opinion. Yes, there is a clinical problem. To address the problem, we are taking the biological samples, we are reading the pathology images. Now, there could be disagreement between this image. If I interpret, there could be, I may be biased. So I will take a opinion of second person. Now who is also a pathologist. Now he will also have a difference in the opinion. Now here to arrive at the consensus, we need an unbiased person. So can we have more than 3 pathologists here because of this particular problem? I'm talking about cancer diagnosis.
Sorry, sorry, I lost.
Dr. Rupa, can you hear us?
I was on mute. Yeah, ma'am, you
Should I
can
should I
apply. Yes, yeah, so
should I
we
repeat?
yes, no. I got your questions. You can apply. So in the team structure, if you saw, there are 2 to 5 members, right? So if there are more than one doctor, yes, you can apply this. Only this thing is within them there has to be one lead. There can be other doctors also. So
Yeah,
it's
I got the
yes,
point. I
yes,
will
yes,
take the lead. I will take the
yes,
lead,
yes,
but
yes.
I'll be adding other doctors.
Yes, you can. So your team strength can be become between 2 to 5.
2 to 5. Okay. Now,
Yeah.
in that, how many clinicians and how many pathologists, for example? Now, there can be 2 clinicians who will bring in the problem, and there could be 3 pathologists. Is that okay?
That is okay, ma'am.
Okay. If I want to add more?
No, then you can't. The team, the restriction is on the total team strength and the team structure.
That is what
Yes.
I wanted. Yeah. And
But you
suppose,
can
and
have
this,
a different team. So from your team, you can have another team registering for this hackathon separately.
no, but why do you want to add another team when we want to enlarge this team?
No, ma'am, we can't do that as in terms of the team structure and that. So we have
No, you
restrictions.
are saying have a subgroup in a main team again.
Yeah, so what will happen? So, as I've told, every team who will be registering under this hackathon, they can come either in pair, like two minimum. The team strength has to be 2 people. Out of the 2 people, there has to be one doctor who's the clinical lead, and other as a technology lead who will be building that solution along with the doctor. But there are
Yes.
other three members which are open. So those three members can be anyone. It can be three other doctors. It can be your other staff. It is open. So your team strength is between 2 to 5 people.
Yeah. So there's a limitation here. That is what you mean to say,
Yes.
isn't it? Yeah.
Yes.
Sometimes what happens is in institute. Now, suppose I'm from Ramaya. I want another two institutes, cancer institutes, to get into. There, they wouldn't agree for one person to get into from their center. Rather, they would recommend two people. So that is when I will land into problem as to whom to select there. That
Understood.
is
Ma'am,
when I.
we can connect separately, because these are certain edge cases that we may get. We will come up with solutions in terms of how we can best fit you in this scenario that you are talking about. So we'll
No,
connect
no, it is
separately for
not.
this.
It is not me. It is me
Yes,
bringing
yes.
other people into. That
Yeah,
is
yeah.
my question. Okay.
Yeah, Dr. Rao, we'll just do this continues the discussion offline, because there are quite a few points on the chat which
Fine,
we'll
fine,
need to
fine, sir.
address.
Fine, sir. Thank you.
Swapna, do we have other
Santosh and
questions in the
Vikas, do you
chat?
want to look at the
Yeah,
questions
yeah,
on the chat? Yeah.
Yes.
yes,
Yes,
Yes.
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 So
Sir, I
some of
have
the
one more
questions are answered.
question, sir. Sorry. I have one more small question. Can we get into even radiology centric problems into this with a solution there?
As
Yes,
Radiology
long as
yes,
based.
they're
open.
operational.
A
Yeah,
non-clinical, but a non-clinical solution. That's it.
yeah.
Okay, fine. Thank you.
So, Swapna, let's look at the comments on the chat. Some of the
Yes,
questions are
yes. So
already
most of
answered. Just
them
look at
I
which are
have,
not answered. Yeah.
yeah. So there is a question on, sorry, one second. Do we have non-language LLM support like image LLM, video LLM support NCG? We'll be sharing a video, right, Vikas?
For the registration, yes, we will be sharing the video.
Yeah.
And there's a question on, can health tech companies also join? What happens to the IP generated out of the outcome? Certainly, the health tech companies are a very critical component of the team, and the IP belongs to the team. If that answers your question.
There's another question in terms of, will this be online? What would be the expectations from participants in terms of hours per week and days?
Yeah. So in terms of the build sprint, so there is a 5 week window where the teams will be working collaboratively online. There will be certain offline sessions that we will be planning at IIT Bombay. However, the grand finale that we have, this is going to be an offline event at IIT Bombay, where we are going to call the top 30 teams. In terms of the commitment from the doctor, what are we expecting on a weekly basis? Around 1 to 2 hours per week, working with your team, just guiding them in the steps, because your guidance and regular feedback and connect with them is very important for them to actually come up with a workable solution based on the problems that you really want to answer. So if I have to give a number in terms of a weekly basis, 1 to 2 hours maximum, you can just connect with the team. What we are also going to do, once we are opening the benchmark matchmaking thing, we are also going to ask the doctor in terms of the hours which they are comfortable with when they can be contacted by the team. What is the communication that they would like to connect, whether it is email, whether it is WhatsApp, whether it is call, and what are the time, whether it is on weekend, whether it is on Wednesday, between these times. So we are going to ask all those questions, and based on that the team will get a clarity, okay, at these times they can connect with their doctor partner.
Because there still seems to be a little bit of confusion about the scope of this call between the clinical and the non-clinical aspects. So maybe you can take a minute to explain that once more.
Yes. So let me do the team structure very. So what we are saying, every team who is registering, right? Every team needs to have like one doctor as a lead, who is looking at what the team is working in terms of the tech solution, or what the tech, whether it is the tech company or the startup that they have identified a problem. So there has to be one person who's guiding these throughout. There has to be one doctor who's the lead.
No,
Okay.
because sorry to interrupt.
Sorry.
That wasn't my point. The point is about some of the solutions that have been proposed on the chat, like clinical decision
Yeah.
support systems,
No,
image analysis.
Yeah.
All of
those
those
are out of
fall
scope.
into, all of
Those
those
are
fall
out of
into the
scope.
clinical solutions and are out of scope for this particular call.
Yes.
The scope for this particular call is actually operational problems that clinicians grapple with daily. Things like How can we schedule patients so that the doctor's time is optimized and the patient spends the least time in the hospital? How can the doctor be better prepared for the clinical consultation by having an AI solution prepare a summary of the clinical notes before the patient enters? So those kind of solutions, more operational than hardcore clinical.
I've posted this out, which are those solutions which is out of scope of this, like whether it is clinical AI, diagnosis, treatment recommendation, clinical decision support, risk scoring, interpretation of medical data, or autonomous clinical advice. All these things are out of scopes. So any solutions which fall under this category, we will automatically highlight them and will collect the team in terms of the scoping them out of the challenge.
And the reason these are out of scope is not because we feel that these are not important, but the fact that these were addressed in a previous grand challenge that we did along with the India AI mission. And we will potentially have another call which looks at all of these later, but not for this call.
Yeah. Because there are a few more questions in the Q&A part which some people have added. One is about who will be ultimately paying for the actual adoption of these solutions.
So right now, from the hackathon perspective, right, what we are only looking at prototypes or MVPs. We are not looking at deployable solution or ready to deploy solutions. What we are thinking, any potential solutions that we see which can actually create a good impact across the ecosystem, we can take up that solution and we can come up with an approach post phase of the hackathon. But from the hackathon perspective, we are not looking for a ready to deploy solution. Even if it is an MVP or it's a solution which you are showing it is solving that problem, that is okay from the hackathon perspective. We may identify certain solution from those category and take them from the phase 2 of the project, where we can actually think of piloting them at centers or clinics or hospitals.
So what we can promise from the NCG side is that all the winning solutions will be displayed on the NCG and the KCDO websites. And typically what we do is to popularize this amongst the NCG member organizations, which themselves are more than 400 hospitals, so that interested hospitals can then take it up and deploy and implement these solutions in their own respective places.
Right. Great. Also, another question is, if someone wants to become a mentor, how can they be?
So right now we have not opened the mentor application. So we will let the other people know when there is a mentor application which is opening up. So right now we are only taking team members. And if they want to reach out to be as a mentor, they can reach out to us separately over the WhatsApp number. We will connect with them and take their next steps once we come to the mentor evaluation and mentor onboarding step.
Because I would actively encourage that those who volunteer to be mentors actually reach out to us right now, because we are likely to need a large number of mentors. So anybody who wishes to become a mentor, please email vikas@koitafoundation.com, right? Or .org.
Yeah, .org. I'm just putting my email and my contact number in the chat session.
Right. Okay. The last question is, what support can the teams expect from organizers, like access to data, funds, etc.?
In terms of the access to data, see what we are saying, it is open. You can use any open source data, right? We are not providing you any data sets, because the problems are the use cases that we are focusing are on non-clinical use cases. So we are not providing any data sets for that. In terms of funding, yes, there is a price pool we have across all these three, and certain solutions we might take up for the post hackathon challenge. Other than that, for during the build sprint, there will be mentors will be assigned to each one of the team, so that they can continuously connect with them. There will be certain sessions at IIT Bombay, which I already spoke to you all about.
Okay. And the last question, because I would like to take, is, are tech developers outside India also allowed to be part of a team?
Are tech developers outside India
can participate, can be part
they
of
have
the
to
team?
be based out of India.
Okay. Okay, great. I think this was a great session. Thank you everyone for making yourself available for this webinar today. If you have any questions, you know that you can just write to Vikas at koitafoundation.org. He's also shared his phone number. and you have the link to the hackathon. I will be sharing the recording with you, say in a week's time. So, in case you have any further questions, please feel free to reach out.
Thank you, Swapna.
Thank you. Thank you, everyone. Thanks a lot.
Thank you so much. Thank you so much, Dr.
Thank you,
Pramesh.
everyone.
Thank you,
Thank you.
Santosh.
Thank you.
Swapna.
You're welcome.
Thank you, Dr. Pramesh. Thank you, Santosh. Bye, Vikas.
You.